to make sure they're all following the law in respect to compensation of staff, of ward representatives, so that they're not being paid arbitrarily and illegally once the members of County Assembly have ceased to hold office. Thank you, Mr. Speaker. Mr. Speaker, the paper is the petition.
Thank you. Thank you, Mr. Speaker, for exercising your authority under Standing Order number 232 to allow us to make a few comments with regards to this petition that this particular committee has dispensed of expeditiously and returned very reasonable verdicts, in my opinion. It is my sincere hope, Mr. Speaker, that once the petitioners get to receive copies, because that's what is expected of us as a House, that once they get the copies of the response of the committee to the petition, they shall be able to use the force that is due to them and ensure that all the entities that have been mentioned comply with those requirements. The issues of public health workers in our institutions since devolution and even before it, Mr. Speaker, are very difficult and challenging. Mr. Speaker, this House, if I haven't lost count, has handled close to 10 petitions with regards to how healthcare workers are treated in various county governments. You know, the Kirinyaga issue that was here recently before this particular petition now with Machakos and the rest of the counties. And it's really encouraging. Perhaps had I taken time to present before the committee, and maybe I didn't get Senator Sakaja's presentation quite clearly, is that the answers that the petitioners will get be applied actually in a cross-cutting manner such that it be the standard across all the 47 counties, that it can be referred to that the Senate has, by way of response to a petition, requested of county governments to ensure that issues of human relations of healthcare workers in this country, Mr. Speaker, are respected and given the due place, the rightful place in our counties, Mr. Speaker. Because these particular officers, these public servants, play a critical role, especially in such a time as now, as we battle such a serious pandemic. When you move across various of our counties, I spent last weekend, Mr. Speaker, visiting healthcare workers in my county, and I could see the struggle and the challenges that they go through on a daily basis, on a daily basis, trying to ensure that our citizens receive the healthcare that is due unto them. I hope this puts this matter to rest, and in the foreseeable future, Mr. Speaker, we shall not be receiving any further requests or challenges in terms of petition on what is happening to our healthcare system. Finally, Mr. Speaker, this is also a challenge to the various county public service boards, because where this problem avails from is actually when county public service board refuses to honor some of these agreements when parties are warring. There is nothing as discouraging as when two parties are warring, that is the employer and the employee, and they end up filing, say, an agreement before the county public service board, and the public services board refuse to honor and say, oh, we were not party to such negotiations. Mr. Speaker, such erode the confidence of our healthcare workers. And in future, when there is a dispute, what will be the trust, or what will be the basis that healthcare workers will use to return to work if the agreements that they enter into are not honored? Therefore, Mr. Speaker, I appreciate what this committee has been able to do, and do hope that this is the final time that we get to hear this kind of disputes. Thank you, Mr. Speaker.
Senator Khaniri, what's your intervention?
Mr. Speaker, mine is a point of order, and rise pursuant to the provisions of our standing orders, in particular Standing Order number 232, paragraph 2. I'll be seeking your guidance. Mr. Speaker, if I remember very well, we adjourned last week on the motion for the formula for resource allocation. If I remember very well again, we were supposed to have broken off last week until September. The only reason we are here is because we did not complete debate on that particular motion. Mr. Speaker, I therefore want us to treat this session today almost like a special sitting. I see there are quite a number of petitions and quite a number of statements listed on the order paper. Mr. Speaker, Kenyans are now glued to their TVs this afternoon, watching the proceedings of Senate. They want to see if we'll get a solution to the stalemate that has been there for the last couple of weeks. Mr. Speaker, I know Standing Order 232, paragraph 2, gives you the discretion. Although at the beginning of the standing order it says whenever a petition is committed to a standing committee, the committee shall in not more than 60 calendar days from the time of reading the prayer respond to the petitioner by way of a report addressed to the petitioner or petitioners and laid on the table of the Senate, and no debate or in relation to the report shall be allowed. It says no debate shall be allowed. But it gives you some leeway, Mr. Speaker, and I can understand why they made this provision to give you a leeway to exercise the discretion of allowing a few comments. Mr. Speaker, in this particular case, we want you, as you exercise your discretion, have in mind that some of us, all our minds and energies are focused on the formula. We know we are supposed to be on break now, not discussing petitions. Mr. Speaker, allow us to go straight to the motion that brought us here today. We can do these petitions and statements when we resume. Mr. Speaker, I plead.
Okay, maybe I just didn't alert you, but they were still uploading the order, supplementary order paper. So I thought instead of just sitting here and looking at each other, we can allow one petition so that then we proceed. So let's close debate on that. Clerk, let's go to the next orders.
Order number 5, papers. Order number 6, notices of motion. Order number 7, statements.
Statements are suspended, deferred to the next sitting. What's your point of order, Senator Faki?
I had a condolence statement to make on behalf of a former member of parliament, the late Ramadan Seif Kajembe, who passed on Friday last week. If we are to defer to September, I think it will be a bit late. Thank you.
I think I'll only allow that one, and there will be no other comments. So I know people would have wanted to contribute, but I think that is important. Senator Faki. Proceed, Senator Faki. What's your point of order, Senator Sakaja? And I still want to encourage that we observe social distancing. These groupings and all that, please, let's avoid. Yes, Senator Sakaja.
Thank you, Mr. Speaker. Mr. Speaker, I appreciate that you've allowed Senator Faki to give condolences, and I know it is to a leader we've lost. Mr. Speaker, I will just ask as well that you exercise discretion after we're done with order number 10, because 2 weeks or 3 weeks ago, there's a statement I brought on the same, and clearly the condolences will expire. And it was a tribute, a long tribute from the committee on Charles Bukeko, Papa Shirandula, as well as Lady Maureen. So if we finish with order number 10, please also allow us to go to that, Mr. Speaker. Kindly, I ask, in the same spirit of expiry of condolences.
Senator Mtula Kilonzo Jr.
Mr. Speaker, thank you. I am of the view that due to the exigencies of time, Mr. Speaker, on our behalf, a formal condolence can be issued by you after the statement by Senator Faki to the family of the late Kajembe, Mr. Speaker, so that you can accommodate the views of other members and other members here who have worked with this good gentleman. Thank you, Speaker.
Yes, Senator Faki. Oh, you're from outside. What's your point of order? Let's avoid, like I said, these groupings and social distancing, please.
Mr. Speaker, I'd requested to raise a point of order on the statements. Mr. Speaker, if you look at the order paper, there are 20 statements. And out of the 20 statements, 15 are raised under Standing Order 48.1. These 15 statements discuss issues that are urgent. I have a statement that's talking about a strike by health workers in Homa Bay County. And it has been pending since last week. Mr. Speaker, because statements under 48.1 By the time they come to the order paper, the Speaker has reviewed, the Speaker has approved, and the Speaker has decided which committee it shall be referred to. May I request, Mr. Speaker, just to ensure that these matters are dealt with the urgency that they deserve, that these 15 statements under 48.1, you refer them to the relevant committees. Because reading the statement on the floor of this House is just a formality. And if we go by past trends, Mr. Speaker, those 15 statements can take this House close to 3 hours. May I request, Mr. Speaker, if not all the 15, but my statement on the state of healthcare in Homa Bay County be immediately referred to the Health Committee so that they can start looking for a solution to the issues that have been raised therein.
That's okay. I think I'll do that. I'll refer, as we continue, I'll look at those that need to go to committees and refer them to the committees to work on them. Senator Faki.
Asante Mheshimiwa Spika kwa kunipa fursa hii kutuma rambirambi zangu na za familia na za watu wa Mombasa.
Order, senators. Senator Whip, Senator Wamatangi. Please, I am pleading with you, let us take COVID seriously. These groupings and movements around, please. Okay. What's your point of order, Senator Wetangula?
Mr. Speaker, increasingly I've been hearing the chair pleading with members. There's no provision in the standing orders for the Speaker to plead. The Speaker directs, rules, and orders. So if there is any breach of the standing orders, Mr. Speaker, I want to encourage you and urge you to order and direct rather than plead, because every time you plead, people just think it's a child's game.
Okay. What's your point of order, Senator Kangata?
Yeah, thank you, Mr. Speaker. Mr. Speaker, I seek your indulgence that your rules concerning social distancing be given a little bit of exemption to whips, because they need to go around to talking to members.
No.
Thank you, Mr.
You're out of order. No. No exemptions. Senator Faki, continue. Senator Kirinyaga, what's your point of order?
Okay, thank you, Mr. Speaker. Mine, the other day, we left this house at 9 p.m., Mr. Speaker. We broke the law as it stands. Mr. Speaker, if we start these side shows, which Senator Kanili has drawn your attention, Mr. Speaker, I think we...
And all of us play our part in fighting this pandemic. The number of positive cases has continued to rise, particularly in Nairobi, which removes the 47 counties, and most importantly, that Nairobi, with the 16,000 plus cases, has now been identified as the epicenter of this pandemic. We therefore urge the continued need of adherence to the measures, and of course, a refocusing back to ensuring that we are addressing the capacity of health services in terms of being able to handle these increasing numbers of cases. Ladies and gentlemen, in line with the approach of focusing on capacity, the ministry has been conducting an assessment. It's an assessment that is ongoing. It is not complete. And so far, in preliminary reports from this assessment, have featured on the various levels of preparedness in our country, particularly when we talk about functional isolation and ICU beds that are immediately available for COVID-19 patients. And it becomes important for us today to share with you the current situation in Nairobi when it comes to this assessment, noting one, that the assessment is not yet complete, it is ongoing. And so in terms of the 19 facilities that we've been able to assess so far, we've noted that Nairobi has a capacity of 1,180 beds, of which 1,104 are isolation beds and 76 are ICU beds out of the 19 facilities assessed so far. This assessment comprises of all health facilities within Nairobi County. It includes facilities under the mandate by the Nairobi Metropolitan Service, private facilities, and also GOK facilities manned by the national government. And from this assessment, what we have found out, and this is very crucial to note, is that 99% of the current bed occupancy, and what this means in Nairobi is that really we need to step up in terms of our preparedness. We have good reports coming in from counties, but it becomes important to note that many of the cases that we are handling within Nairobi County are actually from referrals from outside Nairobi County. And it is clear, without collaboration between the private and national government sector, Nairobi has to put more effort in being able to meet the 300-bed minimum requirement. And there are interventions to ensure that this is underway. We remain pleased with the efforts that have been put in place by the NMS team, who are looking to improve facility coverage and projections so that they can close the gap of these beds. We do recommend continued partnership, as I've mentioned, particularly in NMS with our private sector facilities. We do know in terms of provision of care in Nairobi, there's a 50-50 balance with provision primarily between private sector and public sector, and therefore partnerships become crucial at this point. It is also important to note, and like I have said, this assessment is ongoing. We continue to have officers currently deployed to undertake it. And it becomes important to ensure that all 47 counties ramp up their levels of preparedness, especially because the local transmission of this virus is now spreading fast. Whereas counties have been recording low infections compared to others, it becomes also important to also focus on sensitization. We've long said and emphasized that personal responsibility is very important in the fight against COVID-19. And so we are asking county governments to also invest when it comes to sensitization of the population in the different counties. And we've had good examples of success, particularly in in counties like Mombasa, where they once had a high rate of infections, and there's been a steady decline. A few surges here and there, but a steady decline in the recent days, which is attributed to the strict adherence of containment measures there and efforts particularly that are geared towards behavior change of the population. Over the last 4 days, the Cabinet Secretary has been able to visit 4 counties, particularly Kisii, Kakamega, Kisumu, and Kericho, to assess the level of preparedness of these counties. And the report coming back is that we are impressed by the measures put in place by the county governments in those areas. And we continue, therefore, to urge each and every county to really take responsibility. Talk to the county next to you, find out what is happening. We're extremely pleased, particularly with the Lake Region counties, who will soon be deploying a Lake Region block COVID-19 response. And this is what we are advocating for as we move forward with our COVID-19 pandemic response. Now on to the statistics. Today, 497 people have tested positive out of a sample of 4,171 tested within the last 24 hours. This now brings our total count of cases in the country to 27,425. It pushes our cumulative tests to a little over 350,000 to 362,501 cumulative tests so far. From the tests conducted, 467 are Kenyans, whereas 30 are foreigners. 312 are male, 185 are female. And the youngest is a 6-month-old infant, and the oldest is 80. In terms of disaggregation by the counties, as we've mentioned, Nairobi continues to lead today with 236 cases. Kiambu has 45, Kajiado has 26, Mombasa has 19, Machakos 19, Laikipia 18, Trans Nzoia 17, Kisumu 17, Murang'a 11, Nandi 11, Nyeri and Busia both have 8, Bomet has 7, Uasin Gishu, Kericho, Kilifi, Nyamira, West Pokot all have 5 cases. Garissa, Kirinyaga, Kisii, Lamu, Meru, Wajir all have 3 cases, whereas Nakuru, Embu, and Kakamega, Kwale, and Turkana have 2, and Marsabit and Makueni have 1 case. We have provided for you a disaggregation in terms of the different counties by sub-county, and we'll provide this in the released press statement. On a more positive note, we have 372 patients that have recovered from the disease, and from this number, 315 are from the home-based care program, and we continue to celebrate the success of this home-based care program, while 57 have been discharged from various hospitals, bringing the total number of recoveries to 13,867. We would like to thank our healthcare workers for the good work that they continue to do in terms of helping us get good recoveries. Unfortunately, however, today we've lost 15 patients from the disease, bringing our fatality to 438. And out of the 15, 11 of these cases have underlying conditions. These conditions continue to be those that we've spoken about in the past. I think we have a large proportion of them today being diabetic hypertensives. And then we also have others who have other conditions, such as kidney failure. Our sincere condolences go to the families of friends and loved ones who've lost their loved ones at this time. Thank you. We'd now like to invite questions. No questions. This is a different day, indeed.
My name is Helen Aura from NTV. My first question to you is, we're really trying to sensitize Kenyans in terms of avoiding stigma regarding the virus. But is there really a better way now that we can bury our COVID-19 patients? Because when we see how these patients are buried, we see the healthcare workers who are handling the body are coming all dressed up full gear. So when you take the bodies to like the villages, stigma surrounds that village now. Is there a better way that now we can be able to bury the dead and leave a good image in the families? My second question is, now that Russia has established, or rather established the first vaccine, the coronavirus vaccine, where are we in terms of our own research as a country, and what can we incline also to Russia as well?
Thank you. Thank you, Helen, for those questions. There's more?
My name is Beldino Leula from KTN. I want to ask, what is the recovery rate for older people, especially those above 60 years, and with underlying issues or without?
Thank you. Thank you for those questions. I'll start with Helen's question on burying of COVID-19 patients. Indeed, Helen, that is a concern. It does look very intimidating to have people donned in full PPE gear during the burial of a loved one. However, it becomes important to note at this point the policy position remains that it is very important to ensure those who are coming in direct contact with the body, with the coffin, should indeed be donned in full PPEs. And really this is because we want to protect those people and not take any chances. What we have determined, however, in terms of how we can further demystify this stigma is we're engaging with different communities to see, is there a possibility where we would be able to actually have community members, the loved ones of the person who's deceased, actually conduct, that process and be trained in terms of donning PPEs, so they themselves are the ones who are handling the body and, are then therefore, sensitized on the importance of the PPEs. This is not yet fully endorsed in terms of our protocols. We have our case management team reviewing this to see how family members can further participate in that burial practice and perhaps be the pallbearers as opposed to the medical, clinicians, which can be intimidating and which can bring issues when it comes to closure. And so we are working on that, and I must emphasize this is not a final position, but we are reviewing how we would be able to then roll that out to, ensure that there's participation of the family during the last rites. And then, of course, when this is ready, we'll be able to deploy it, and we'll be able to define the mechanism through which that can take place. With regards to the second question on Russia and the vaccine, yes, we've seen the reports. We, through the Ministry of Foreign Affairs, shall engage to find out, what exactly, what vaccine has been deployed. Is it working? It becomes important always, every time you have a new vaccine, to test it. And I'm sure Russia itself is probably going to be conducting, studies, even as they deploy their vaccine, to ensure that it is actually effective. Back here at home, we are very proud of our scientists. Yes, Kenya is participating. We're in the second phase, and we have teams that are working, and we'll continue to appraise you in terms of our progress back here at home. And also, if it should be necessary for us to then plug into the Russian vaccine, that will happen in the laid down protocols and regulations of us being able to access that vaccine. The last question on recovery rates is a good question. We have a study underway to be able to really look at our critical cases within the country and to be able to define exactly what a recovery rate looks like. It becomes important to note that when you're, say, diabetic and you have COVID-19, you may recover and turn negative at a point, but further assessments are required to see, are there any longer-term effects of you having contracted COVID-19 and had another additional comorbid state. And so there's an assessment underway, and if you give us time, we'll be able to share with you what has happened retrospectively in the country since 1st March, so that we can be able to tell what exactly is the prognosis of our recoveries, particularly those who have additional conditions, the diabetes, the hypertension, the renal failures, the anemias. Those are the main ones that we are seeing. So thank you so much. I'll ask Dr. Kibias to add on if he wants to add on at this point.
Thank you, Cass. I think it's very important to note that the prognosis is poor in those who have comorbidities and those who are 60 years and above. So, and the mortality attributable to comorbid and 60 years and above accounts for about more than 40%. Thank you.
Thank you so much.